Are you guys tired of popping pain pills like candy and still not getting a good effect from it? Well, have no fear because dry needling is here. And no, it's not some medieval torture technique. I promise, it's really effective. Watch and find out why. Dry needling is actually a super effective technique used in physical therapy to help treat muscle pain and dysfunction. It involves sticking a thin needle into a specific trigger point or muscle knot. It sounds scary, but trust me, it's not as bad as it sounds. It's a tiny little ninja that's giving you a quick muscle poke to release all that built up tension that you have inside your muscle. But don't go confusing dry needling with Chinese acupuncture or Eastern medicine acupuncture. Although they use the same tools, the techniques are actually a little bit different. Acupuncture is based on Chinese medicine and it involves sticking these needles into specific points or meridians to help you increase the flow or restore the flow of qi throughout the body or your body's energy. Dry needling, on the other hand, is taking these same needles, so again we're using these thin acupuncture-like needles, and targeting these small specific trigger points. So if you ever roll your hands on your shoulders or into your muscles, you can feel these tight bands of tissue. So we're taking these needles and poking it into these tight bands of tissue to help release the muscle tension and improve its function. So dry needling is like the cool, more modern cousin of acupuncture. So dry needling is a great option for all kinds of muscle pain, dysfunction, ranging from say just muscle soreness, muscle tension, to headaches, to joint pain, and just helping you really get a good release. Occasionally I even use it for things like sciatica, where you can have tension of the muscles compressing on nerves in the lower back or in the hips to help release some of that tension in those muscles and henceforth helping you reduce that irritation onto the nerve. It's like a magic trick that can help promote healing to the body and increase blood flow to the area by stimulating your body's natural healing response. So you're taking these needles and you're poking the crap out of these muscles and stimulating a inflammatory response, but really controlled. And as a result, it's going to start and stimulate the healing process that your body would naturally go through. So if you're tired of feeling like a stiff, creaky old robot, give dry needling a shot. Now let's talk about the elephant in the room. A lot of people ask me, does dry needling hurt? Well, there is no simple answer to this question because it depends. Some people describe it as a little prick, while others describe it as a mild ache or pressure, and of course I get those patients who jump off the table when I poke them with a needle. But the good news is it's usually pretty quick. I usually take the needle, insert into the muscle and take it out. It's not like acupuncture where you would leave it for 5, 10, 15, 20 minutes and have you lay on the table. So you guys getting those Final Destination vibes. It's nothing like that. It's literally taking a needle, poking it to the muscle and taking it out. So within a few seconds, it's in and out. I've also had patients describe the sensation of a menstrual cramp, but let's say, for example, I'm poking the arm, it felt like a menstrual cramp in the arm. So I guess you kind of get a sense of how it feels. And of course, just like anything else, there's going to be risks involved. We have to think about the risk-benefit. It's a very aggressive but very effective treatment in helping to release muscle tension, muscle knots, and reducing pain, restoring function and range of motion, and improving blood flow to the area of treatment. And as I said, there are risks involved. So generally, we see side effects that include, say, bruising, irritation of the skin, sometimes some irritability of the muscle. Major side effects would be, say, a pneumothorax, which is a collapsed lung, which obviously taking a sharp object around the chest area, inflatable chest area, you can puncture the lung and cause a pneumothorax. Luckily for us, though, we are extensively trained as physical therapists. Most go through multiple weeks, multiple years of training, and over time we know the safest techniques and safest ways to use these dry needling techniques to reduce the amount of risk involved. In my 6 years of treating with dry needling, I have never had, knock on wood, anybody with a pneumothorax, and the main side effect that I've experienced is just some bruising and irritation. So in conclusion, dry needling is super cool, effective technique, and it can help with muscle pain and dysfunction. Now, if you're feeling super nervous about it, remember it's not as scary as it sounds. Check out some of my videos up here and see how I actually apply these needles. And most people are actually pretty comfortable with the needles because it's, like I was mentioning, it's really quick. It's in and out within seconds. And the effects are such a long lasting that the risk to benefit is much, much better. So go ahead and give it a try. And who knows, maybe you'll love it so much that you'll continue getting it done. And don't forget to check out some of these other videos up here. Again, I go over dry needling, how it's effective, and I do demonstrate in multiple areas of needling, usually the shoulder, the back, the hips, I do quite often. Again, dry needling is performed by licensed physical therapists or physiotherapists, and generally you have to be practicing for some time before you can actually train in dry needling, so not every physical therapist will do it. So if you are interested, give it a check out. Contact your local physical therapist and see if they do it and see if you like it, and who knows, maybe it'll help you with your pain and dysfunction. You'll never have to pop those pills again. Catch you guys next time.